Thank you all so much for joining us today. My name is Emily Kile, and so we try and do a webinar once a month on a Wednesday, so it must be Wednesday today. So thank you all so much for joining us. I am totally thrilled to have Lori with us today. I will read you her bio, but she is also one of my most closest and treasured friends. So I am honored to have her here in her professional capacity, as well as just my friendship. So she is a licensed clinical social worker and the Family and Community Services Director at the Banner Alzheimer's Institute and Banner Sun Health Research Institute. She has spent more than 20 years specializing in leadership and clinical positions, serving the needs of patients and families coping with emotional, cognitive, and behavioral problems. Lori serves as adjunct faculty member at Arizona State University Edson College of Nursing and Health Innovation, and serves on the Arizona Dementia Caregiver Alliance, as well as the End of Life Care Partnership. Ms. Nisson was awarded a Practice Change Leadership in Aging and Health Fellowship, and she is an incredibly wonderful human being. So, Lori, thank you so much for joining us today, and we look forward to your presentation. For those of you who have questions, just please make sure you type them into the chat box or the Q&A, and hopefully my tech skills will be good enough for me to see them, and we'll either answer them throughout the program or at the end. So with that, it is all yours, Lori.
Great. Thank you, Emily. Thank you for inviting me. And it is just a pleasure to have an opportunity to present today. It's always good to connect with you professionally and personally. And I think this is a great topic because I think people are most afraid of developing memory loss. So we're going to talk about that and really talk about some of the symptoms, but then we're going to talk about some solutions, opportunities to delay the onset of memory loss, things that you can do to really keep your brain healthy. So we'll move on to the next slide. And I will share with you a little bit about what I hope we're going to cover today, which is really the difference in the semantics between Alzheimer's disease and dementia. Talk specifically about warning signs for memory loss that you should be looking out for. Often it's someone that you may know that's close to you, a neighbor, friend, family member. Think about some opportunities to really preserve your own brain health, which is something tangible that we can do. And when we have control over things, it makes us feel better. And then also talk about opportunities for help and resources if somebody you know does have a memory problem. And also if you're just trying to learn more about dementia or you want opportunities for your own wellness. Next slide. So this is a big conundrum, and feel free to drop it into the chat if you feel like it. You know, people always ask me, what's the difference between Alzheimer's disease versus dementia? Or I often hear family members say, you know, my mom was diagnosed with Alzheimer's disease, but she does not have dementia. And feel free to shout out, Emily, if you notice anything important in the chat as we move along. So I think really the difference here is that dementia is really the umbrella term. So it's like if Emily and I know someone recently who was diagnosed with cancer. Cancer is really that umbrella term. And her next question to me is probably going to be, well, what type is it? And so the same is true with dementia. We have kind of an umbrella term here. And the terms get used interchangeably, often because Alzheimer's disease is the most common type. So we say about 60 to 70% of people who have dementia have the Alzheimer's type. And then we were in a previous seminar a little while ago, and we were talking specifically about Lewy body dementia, which is actually the second most common type of dementia. And Lewy body is kind of like a mix of Alzheimer's symptoms as well as Parkinson's symptoms. So I kind of think of it as a hybrid of a memory disorder and a movement disorder. And then of course you could have a vascular dementia, which means that as a result of strokes or mini strokes, you develop changes in the brain and that affects your cognitive and other abilities. And then less well-known and less common is a frontotemporal dementia that typically, as it says, really affects the frontal lobe and hits people a little bit younger age often in their 50s, where we think about Alzheimer's disease as being the onset of 65 or older. And frontotemporal dementia can be difficult because there can be behavioral disturbances as a result. There can be language challenges as a result. And so I think my main point here is this is an umbrella term called dementia, which really talks about or explains the syndrome, which really can affect everything from memory to language to behavior and personality. And so all of us have a day where we're more forgetful, we're feeling a bit airheadish, or we just do things that maybe we're too hurried or too stressed. But we're really talking about a pattern of behavior and change in cognition, memory, and other parts of the brain that really affect your ability to manage day to day. Next slide. So I think some of the early signs to keep in mind are memory loss. And so we know that what affects memory first is the short-term memory. So, you know, people who have early stage Alzheimer's or another type of dementia often have almost a heightened long-term memory. So if you ask them where they're from originally, or how they met their spouse or partner, or what they did for a living, they can often tell you that pretty easily. But if you start asking questions about, you know, what was your day like yesterday, or, you know, when do you have that appointment with the elder law attorney, that's where they seem to struggle more with the short-term memory. And so, you know, you start seeing challenges with things like, you know, dates. And then because the brain is kind of like a hard drive, when my memory is failing me, it's hard for me to store new information. And so often you have care partners say, well, my person's asked me the same question 10 times today, and I'm so frustrated. Well, they're not doing that to annoy you. What's happening is that they know there's something going on. They know they have an appointment with Emily Kyle's office, and you've told them that a bunch of times, but they just can't store it in the brain. And so they know something's coming up, but they can't recall what. And so often there's a lot of anxiety around that. So the best way to handle that is to just be gentle about it, repeat yourself, just use a short, simple sentence, and just prompt the person. Maybe you write it on a whiteboard, or, you know, a large piece of paper, or refer them to a calendar to just kind of help them problem solve. The other challenges that we see early on, and so this is why if you don't have things like your estate and advanced directives in place, you should definitely do that on your own, or seek, you know, services with, you know, a Kile law office or someone else to really make sure that these things get in place. Because when you're in the early stage of memory change, you are already going to have some difficulty with things like finances, managing bills and mail, handling instructions, maybe even changes in your ability to concentrate. So when I was in a private practice, I had a woman that I worked with, and she was in the mild cognitive impairment stage, which actually precedes Alzheimer's disease. And some people actually convert into Alzheimer's disease, other people don't. But she was really struggling with having these memory changes. So she came to see me for counseling. And she had a copay with her insurance. And she sent me the copay like 3 different times, because she mailed it out and then she'd forgotten she'd mailed it, so she did it again. So fortunate for her, you know, I had an understanding of what was going on, and, you know, I'm fairly honest, so I just let her know about it. But you could see how people with even mild memory problems can get into financial exploitation or other challenges as a result of mild memory loss or very early signs. So the other thing that happens is just difficulty with familiar tasks. So when people have an early onset, maybe they're, you know, before the age of 65, or maybe, you know, 65 to 75, and they're still working, they're starting to struggle with things that used to be really easy for them at work. Or maybe there's like a new technology at work, and they were doing fine, but now they're having a really hard time learning something new. And so that can really trip people up. And then, of course, home life. So there was a woman that I worked with who was in the very early stages, had a lot of depression around having this disease, and always enjoyed cooking huge meals for her family and, kids and grandkids. And, one year was hosting Christmas and, put salt into her baked goods instead of sugar. And so you can see how, that could be really easily mistaken, right? They're both kind of white powdery substances, but, it really crushed her that, something that she really took pride in was becoming more difficult. And then, you see some folks who don't have a good insight into why they're struggling, but they just know that there's a problem. So maybe they've always played bridge with the same group of people, and now they're not playing the game right or properly, or people around them are getting a little bit irritable. And so they might drop out of the game. And when you ask them why, they're saying, well, I don't know, those people are just, I don't enjoy hanging around them anymore. Maybe they're aware that their game is suffering, and sometimes they're not so aware, but they just know that the situation is no longer comfortable for them. Next slide. So trouble with orientation. So dates, times, location, and navigation. So actually, in this day and age, there are lots of helpful prompts. So people who are still high functioning, but having some mild memory changes may be able to get to simple places like the Safeway where they always shop, or the senior center where they play pickleball. But now they're maybe using GPS, for example, to help prompt them to kind of keep them on task. But people have a hard time with dates, keeping time. Sometimes that calendar that's always worked well for them, and now they look at the whole month, it feels really overwhelming. They're having trouble discerning, what really is happening this week on Monday versus Wednesday. And so orientation is definitely a challenge for people with early memory loss. And with early memory loss, you might have all these signs, but if you're starting to see that they're piling up, or you have more than one, or someone that you really care about it's a great opportunity to try to get an evaluation. And we'll talk about that later. So spatial skills. So I've had some folks who come to one of our institutes, and they've been to see 3 eye doctors, and the eye doctor, each one has said to them, there's really nothing wrong with your eyes. So what's happening is that the brain is having trouble with visual spatial skills. So, I don't think I have a memory problem, but I don't have great visual spatial skills. You definitely don't want me packing up our car before we go on a road trip. I'm not great at that. But if you're normally decent at it, and then you're really having a struggle, that maybe there's a change. Also, this is, again, why driving can be challenging, because even early on, people are having trouble with orientation, but they're also having a difficult time judging distance and depth, which can lead to some fender benders, even with mild memory change. Also, color and contrast is difficult. So we often advise care partners or friends to, maybe put a colorful placemat down before they set the plate on top, so that there's some contrast. It's easier for them to process and perceive. And so we think about this like a camera, where you have, a camera that takes the picture, but you're having trouble processing or developing it. So the eyes are seeing the image, but the brain is really having a hard time processing. Next slide. So other challenges that we see are problems with language. So people who are having a difficult time communicating their needs, really having a difficult time with conversation and repetitive speech. So the woman that I told you about that I had the pleasure of working with, who had a really hard time organizing dinner for her family on Christmas, also told me that, when, she would say things like, Lori, when you go to coffee with your friends, that's like a time for you to relax and share a lot of ideas. But for me, when I go to coffee with my friends, it's very stressful. I'm trying not to let other conversations get in the way of my concentration. I'm trying to appear normal. I'm trying to answer the questions that you might be asking me, while it takes me a while to process. And you might ask me a question and then I forget it. So I'm having to really concentrate on what you're saying, or maybe even ask you the same question a few times. And that's stressful for me. So definitely some problems with language. And we see that even with the disease progression, right? So someone who's emigrated to this country from Spain, for example, and spoken English for many years, as dementia develops, they may have a really hard time with the short-term memory. Well, the shortest term memory is English for them. So they're often going to have trouble with their English first. And then later, as the disease progresses, may have trouble remembering Spanish, which was really their native tongue. So losing things, okay, how many of us have done this today or this week, right? We all lose things like keys, cell phones, and then we have to retrace our steps. But what's hard about short-term memory loss is that it's really hard to retrace your steps if the short-term memory, those things you just did, aren't being stored properly. And so, you know, any of us can lose items. And then there are just people who are not great at keeping track of their items. My brother-in-law visits a few times a year, and he is just notorious. No matter what he does, he always leaves something at my house, no matter what. I don't think he has dementia. He's just not great at keeping track of his items. But if you are good at keeping track of items for the most part, and you start noticing this is a pattern, you definitely want to seek some help. Often the person with early memory loss is less aware of it than people around them. And so what happens is you are certain that you left your keys in the hallway, and someone you're living with, you might start accusing them of stealing your keys. It's not because you're trying to be difficult or be accusatory or paranoid, but if you really feel certain and sure that you left something in one spot and then it's not there, you might get a little suspicious, like, you know, why aren't my keys there? You know, maybe you took them. Did you accidentally put them in your purse? And so that's where that kind of suspiciousness may come from. Sometimes that suspiciousness actually translates, you know, from missing items. Poor judgment. So another reason it's really important to have your affairs in order, because even early signs of memory loss can have us doing challenging things like forgetting to pay the mortgage, or making poor decisions about money. There was a widow that I worked with who was having early signs of memory loss, and she'd lost her husband a year ago, and her husband they had a very traditional marriage. Her husband took care of all the outside stuff. She took care of all the inside stuff. So one summer around this time, monsoon season in Arizona, somebody rang her doorbell, and they were showing her a tablet with a picture of what they said was her roof with a gaping hole in it, and advised her that, you know, monsoon season was in full swing, and but not to worry, because they could repair this damage today for, you know, only $750. Well, you know, she's you know, probably still grieving the loss of her husband. She hasn't tackled a lot of these kinds of situations. The guy, frankly, probably scared her, and her judgment was impaired. So she wasn't thinking to herself, well, how did he get up on my roof and take that picture? Was that possible? Or maybe this really isn't a picture of my roof. Maybe it's my neighbor's or somebody else, or maybe I should get a second opinion before I just write this guy a check. Well, she was not in doing well, and, you know, made a poor judgment call and wrote this guy a check, and, you know, the money disappeared and there was no hole in her roof. So this can happen very early with memory loss. It's just really making poor decisions about money, making poor decisions like today. It looks sunny and beautiful out here in Arizona, and I'm looking at my watch. It's really already 99 degrees. And so when I'm inside, it looks like a nice, perfectly wonderful day to take a walk. But, you know, I might put on a jacket and set out on a walk, and then all of a sudden I realize, wait a minute, this is really hot. And by the way, I shouldn't be wearing a sweater. So I think, you know, there can be that kind of lack of awareness or poor judgment that comes with early memory loss. And as we mentioned and gave that example, you could be very early or very easily susceptible to an exploitation. Social withdrawal. So this apathy, this kind of lack of motivation or social withdrawal are some of the very early signs we see. So someone who's always really enjoyed going to the grandkids or neighbors' birthday parties, all of a sudden it's just like, no interest. What do you mean? You always are the life of the party. You've always really enjoyed these events. Yeah, I'm not up to it. And so the person might make excuses or resist attending social events, start to withdraw from family because, just having those simple conversations or being around large groups of people can really be overwhelming when your brain isn't functioning at the highest level. You find noise very overwhelming or upsetting or distressing, or you get in a big group and you have trouble holding up your end of the conversation, or the whole thing just feels really tiring to you. And so often that person starts really withdrawing from events. And then, we see people who are having maybe changes in their mood or personality. So one thing we do know from research is that particularly people who've never had a mood disorder, when they find themselves later in life having the onset of depression, that's often a signal that memory change may be coming later. Because these are both brain illnesses, right? And so we often see changes in mood or personality. In people that are aging, I tend to see depression a little bit differently. Maybe you think about it as being, having periods of tearfulness, but often it shows up later in life as mood irritability or grouchiness. And the person's really struggling with things day to day, but they're maybe not aware of it, or maybe they're just really having a hard time adapting to these memory changes. And so they get very frustrated very easily with things. And often they're having a really hard time adapting to change. So any subtle change can really trigger, the person to feel more confused. So we often see this in our practices when we have the pleasure of meeting with families in Tucson or in the Phoenix area or even in the Sun City area, where some of those folks don't live here all year, right? They live here, and then around April or May, when things heat up, they hit the road and they go somewhere cooler. Well, the person with early memory loss might have been familiar with both of these homes for a long time. But when they get to this new place, they might be more disoriented. They're thinking that, the bathroom at their home in Phoenix is always, when they get out of bed, is always on the right side. But now they're in their place in Iowa, and when they get up, the bathroom's in the left side. So you see that there's more disorientation. They're having a hard time adapting to change. You see that frequently when people start taking vacations, particularly because that's often a very new environment to them that they haven't experienced. And so those difficulty adapting to change in the environment and changing routine. We see that a lot as well when we're talking about holidays. So people have developed a really good routine. Maybe their care partners, their partner has gotten them down to a good routine, and then all of a sudden the routine's out the window because it's Thanksgiving or Hanukkah or Christmas, and there's all this family in town, or the usual structure of the day is different, and that can be really distressing to somebody with early memory loss. And so I think those are some of the early signs you really should look for. And then, what do you do about that? So I think, everyone is capable of having a rough day, but I do think it's worth talking to your primary provider, because there are things that may be affecting your memory that are frankly reversible. So if you started a new medication, for example, maybe it's a side effect to that. Maybe you're having other symptoms like painful urine when you go to the bathroom, and you've got a delirium, which is when you have really just a change in your mentation or cognition as a result of a new medication, or being dehydrated, or an infection like a urinary tract infection, pneumonia. One of the first things we check for when we're doing a new evaluation for memory loss these days is COVID, right? Because that can cause all kinds of symptoms. And so it's a really good place to start it, maybe that your B12 is low. So I think it's always good to, when you notice a pattern or people around you do, it's a good place to start. And so my rule of thumb is always just start with your primary provider. So it's a really good idea to get a medical evaluation And if you're, if you're over 60, even ask your medical provider, physician, nurse practitioner, or PA, like, could you do a memory or thinking screening? Even if your memory is good, if you're in that age category, it could help set a baseline for you to really monitor. Many primary providers are very well equipped to administer something like the MOCA or the mini mental status exam, which is a 30-question screening tool to just evaluate memory and thinking. And if you get a perfect score, great. Then you'll have that to compare to in later years. If it's something more, though, this is a great path to take because you want to get a clear diagnosis. Why? I mean, people think that there's really nothing we can do, and that's actually not true. There are medications that can slow down the progression of the disease. It also is a great wake-up call to get things like advanced directives, financial affairs, your will in order. And it's also just a great way to prioritize life. I mean, we all think that we're living life to the fullest, but we put off things, even pleasurable things. And so if there is an early memory loss diagnosis, or maybe we're in the early stage of Alzheimer's disease, that's just a great opportunity for us to really prioritize what's important. Maybe we wanted to travel more, or maybe this is a better time to retire a little bit early and try to enjoy life. And then figure out ways to take medications or other interventions to really slow down progression. I've seen people who get diagnosed with mild cognitive impairment, which actually, as I mentioned, comes before Alzheimer's disease, and have made a lot of good lifestyle choices and worked with their primary provider. And they've stayed in the mild cognitive impairment phase for many years because they got this very early diagnosis and started taking steps to really improve their diet and their exercise, and really look at other factors of wellness that we're going to talk about with brain health to really help optimize and maximize their lived experience. And then I would say bridge to a care team. So I was saying that I was in a webinar earlier that was about Lewy body dementia, and there was a woman talking specifically about her lived experience with the disease. She's very early stage. And she said, this was really a hard diagnosis for her, but she really optimized wellness by using meditation and yoga to really help manage anxiety or feelings around this diagnosis. She said that it was a great opportunity for her to get engaged in a support group, to advise other people about her experience, but also learn from others about how to live well with dementia. And then she also talked about seeing a counselor just to really help her adapt to some of these losses and not just focus on losses, but really focus on how many strengths and things she still could do, and really make that her priority. And then I would say that, exploring opportunities for research participation is really a good way to leverage wellness. So people often ask me, so what if my primary provider is telling me, or I'm the care partner for somebody who I believe has memory loss, and they're saying, oh, this is just part of old age, or you're just fine. And I think it's really something more. So the analogy I always use is a dermatology one. So if Emily and I were talking and she told me that she woke up this morning with a rash on her face and she was feeling anxious because we're going on camera, I tell her, Emily, just call your primary care provider and see what that person can do for you. If she talked to her primary provider, maybe saw him or her in the office and got a prescription for a salve, and a few days later it went away, she would just check that right off her list, right? She felt like she was understood, she got a good intervention, and that's great. There are lots of providers that, particularly ones who specialize in adults and aging adults, that do very well in prescribing Aricept or another medication to slow down the progression, that really hear their patients, that are really good at treating dementia, and that's great. Go with it. But if you feel like the primary provider doesn't have a good understanding, or you really feel like you're having some unusual symptoms, maybe there's some behavioral disturbance or really emotional change, or you're just not getting your needs met, what would be the next step? So if Emily's rash didn't go away, likely her next step would be to see a dermatologist. So I think the same is true with dementia care. I think if you don't get what you from your primary provider, and be an advocate, ask for what you need. And if you're just not getting what you need, or that provider just isn't, primary care providers, even the best ones, are just tackling so many different types of illnesses, it's sometimes hard for them to really specialize. So then, the next step is really to see a specialist, talk to another physician. Maybe it's a neurologist who specializes in memory disorders, or a geriatric psychiatrist or geriatrician even, who really is more skilled in diagnosing Alzheimer's and related dementias. And maybe they'll tell you the same thing, or maybe they'll say, I think this might be something more. And then they'll do a full workup with you that could include things like labs, neuropsychological testing, maybe even some brain scans to kind of figure out where you're at. And then I think research, as I mentioned, is a really great opportunity, because, we think about research as a last resort, but that's actually not the case at all. We have opportunities to participate in research, to really advance care, advance opportunities, but also to really give you opportunities to optimize your care. I mean, we did have a new drug that came out last year, aducanumab, which is an infusion drug, but for many people, that was a solution that they really wanted to try if they were in the mild cognitive impairment or early stage disease that has had some effectiveness in really slowing down progression in the disease process in the brain. There's lots of other opportunities for research that are pharmacological. So maybe you're taking a drug and you don't know if you actually have the true drug, or you're taking a placebo, but there are also studies now on alternative options. So using non-medical interventions like diet or exercise to really look at what interventions, either medical or non-medical, can really affect or impact or slow down the trajectory of the disease. Next slide. So let's talk about how we can take some action. So what are some things that we can do to look at opportunities to really stay well? So I'll just give credit to a community partner, which is the Global Alzheimer's Platform. They actually have a great website, and they outline the 8 pillars of brain health. So some probably seem really obvious to you. I mean, one of the best things you can do that we know is exercise. We say what's good for your heart is good for your brain. But then there are lots of other things that you can do that maybe you didn't know really affect or impact your wellness. So this is just giving you kind of a snapshot of it, but we're going to delve a little bit deeper into more detail. I think things like connecting with friends and family, so staying socially engaged is really helpful. I think there are even opportunities to make your brain work, right? So we're always, if we're at work or we're at a gym, or we always drive usually the same way, but think about maybe taking a different route home. If you already are really proficient in English, maybe this is a good time to take a dabble in Spanish, maybe learn a new language. Or maybe you've never learned to play an instrument. So this would be a great opportunity to learn something new, to open new pathways in your brain, and to really just keep learning and growing. So these are the 8 pillars. We're going to just drill down a little bit more specifically on several of them next. So as I said, one of our retired medical directors at Banner Alzheimer's Institute, Dr. Bill Burke, used to always say, get hot and sweaty 20 minutes a day, several times a week. And what Bill was talking about was really staying physically active, really. And so for some of us, we've built that into our routine. And for others of us, I can hear you groaning. I get that, but there are small ways that you could really build in exercise. So, I mean, I think if you work in a building, I work on the 3rd floor when I'm in our downtown office, and I always try to take the stairs. And so not everyone can do that. So it's good to really think about fitness that aligns with your abilities. So some people, can run a marathon, or they're trying a triathlete, or they could work out at the gym for 45 minutes. Maybe that's not you. And maybe you're physically okay shape, but you want to get more involved. So just set small goals for yourself. So just walking 10 minutes early morning, especially here where it gets to be hot late in the day, it's a perfect opportunity to do two things at once. It's especially if you just listen to the birds. It's a great opportunity to connect with nature. It's a great opportunity to just get a little bit of exercise. It's a great opportunity to get your path for the day on a good course. But if you don't have that luxury, or maybe you're, in that sandwich generation, maybe you're working full time, maybe you're taking care of aging parents and you're trying to manage your own children, that's really a hard ask, right? So, I mean, just even parking at a farther entrance from when you go to the store or to pick up something is a great opportunity to increase your steps. There's so much technology now that you could really measure how you're doing. And for a lot of people, wearing a smartwatch, for example, is a good way for them to really get encouragement. Wow, I walked that well today. Maybe I can do a few more steps or a few hundred more steps next week. And then if you don't have any equipment, there's lots of opportunities. So I am very much a gym person. And when my gym closed down a couple of years ago with the pandemic, I was, theoretically wearing a hole in my carpet, pacing around, figuring out what I was going to do, because that's a really good source of physical activity, but also mental wellness for me. So finally I had to stop, complaining about it and do something. And I started walking every day, very early in the morning, walking and running with my dog. And I'm telling you, like, it was such a good experience for me. I actually learned how a pomegranate blooms. I started watching my neighbor's tree and seeing that these red flowers actually developed into a pomegranate, and really taking kind of more notice about nature around me. But there's opportunities to do both, right? A little bit of cardio exercise and then also some strength training. So you could use weights, or you could even just use a household item like a soup can or a jug to just do a little bit of light strength training. And definitely check with your doctor if there's any questions about that. So, I don't want you to create any kind of injury, but anything you could do that's even low impact is going to be healthy and good for your wellness, and could help stave off the onset of dementia. And then, of course, eating well, which we all sometimes do a good job of, and other times need to remind ourselves. Things like fruits, vegetables, whole grains, nuts, lean meats. I know people who say, I can't give up meat, but I try to only eat red meat once a week. Or there are other people who try to be a vegetarian one day a week. But I think even just making some small changes, replacing your butter with olive oil is a great opportunity. Cutting out unnecessary sugars and salt, switching your dessert to fresh fruit, for example, is a good way to do it. And then just being aware of how much alcohol you drink. There actually are some studies, and you can always find a study to support something, right? There are studies that show things like drinking a lot of coffee can stave off Parkinson's disease, or drinking red wine can stave off Alzheimer's disease. Well, everything in moderation. So I think things to think about that support good brain wellness are things like berries, dark leafy vegetables, even dark chocolate in moderate amounts can be ways for you to enjoy those things and still support really good brain health. Next slide. And then getting involved in research. So I'm not a researcher, but most of my colleagues are. So I know how difficult it is to advance research, because our number one issue is that we just don't have enough participants. And I think it's just because people don't realize that getting involved in research can really advance and move the needle. So if you're someone who's interested in research, keep an open mind. You never know what opportunities might be available. You could even talk to a research coordinator at our institute, or we're part of the Arizona Alzheimer's Consortium, which actually our research CEO, Dr. Ryman, established, which really is 7 entities that offer research on the prevention and also intervention for Alzheimer's disease in Arizona. Places like Barrow Neurological Institute, or one of our institutes, or Mayo. Seek opportunities at one of those places as an opportunity to really get yourself involved. If you're someone who has a family history of Alzheimer's disease, this might speak to you. This might be a way for you to really give back. Or if you're interested in preventing the disease, There are lots of prevention trials. In fact, we have a whole team that is focused exclusively on prevention, which I'll show you on our last slide. So how do you really find ways to be involved in research, that works for you? Some studies are remote, some you have to actually go into an institute. But just know that one of our big hindrances in actually advancing the research is not having enough people who want to participate. So that's one way to have your voice heard. And I would say, particularly if you are of a unique or diverse culture, this is a way for your community, for your population to be represented. Because frankly, we don't have enough studies that are done on unique and diverse populations. And often Alzheimer's disease affects them in greater numbers, like in our Hispanic and Latino communities, in our African American communities. And so if we exclusively do research on people who are Caucasian, we won't find those answers. So this is a great opportunity too for us to learn more and for you to hear your voice heard and represented in research. Next slide. So other things that you can do just at home, improve your sleep. So establishing a regular, relaxing bedtime routine. So my cousin has 2 small children and she laughs when I tell her this because she's got like a 6-month-old and then she's got a 3-month-old and she works 3-year-old and she works from home. She's like, Lori, whatever. But she does try to rest and relax when her kids go down for naps. She does try to get in bed earlier. So establishing a regular bedtime routine is going to be really healthy because there are studies you may have heard about that actually connect sleep with memory loss. So also, if you're having trouble sleeping or you're someone who snores, we know that there's the data that says that people who have sleep apnea, you might not even know you have it, but if you have a partner, ask them if you seem like you stop breathing or you snore a lot, that can actually affect the amount of oxygen that gets to your brain. So if you're feeling fuzzy, it might be that you have sleep apnea, for example, and if you get treated and you're treated for the sleep apnea, actually you might find that you're actually thinking more clearly and sleeping better. So avoid or at least limit daytime napping, because I think people who don't sleep well at night, of course, they're exhausted. But if you end up sleeping an hour or more during the day, we know that that can have an integral effect on your nighttime sleep and really not lead to good outcomes. So doing short napping or closing your eyes for 20 minutes is going to be a really healthy way for you to recharge. There's also lots of opportunities for you to use things like mindfulness. So if you're not a good sleeper, insomnia has always been a challenge for you. Talk to your doctor about something like melatonin, for example, or using a mindfulness app. I mean, there's lots of them that you can subscribe to for a very low price, and actually several that are free that you could use, when you're in your room and you get into bed, or even before you get into bed, to just unplug your brain before you lie down and then have all these racing thoughts that really impede your ability to get a good night's sleep, because sleep affects everything, right? It makes your pain worse, your mood worse, and it certainly affects your memory and thinking. On days that I don't sleep well, so those are the days I'm trying to hunt down my phone because I'm more absent-minded. And then just key ideas like avoiding caffeine. If you're someone who has to urinate a lot in the middle of the night, stopping fluids a couple hours before bed can really be a good way for you to sleep better, get less interrupted sleep. Of course, nicotine and caffeine are stimulants. And alcohol. People think that alcohol is a good way to help you fall asleep. Well, when you start drinking more alcohol, it actually impairs or impedes your sleep and actually affects your REM sleep cycle. So think about those things as you think about your daily structure and your nighttime habits. And then, of course, exercise your mind. I mentioned this earlier, learning a new language, taking a class just that you've never heard about before, wanted to learn more about. Use your non-dominant hand to do things, or take a different route home from the office. And then there's lots of ways to give back that also exercise your mind. Volunteering is a great opportunity, or joining a club is a great opportunity to stay social, which is good, but also to really exercise your mind. Next slide. And then, of course, staying connected. So, especially for those of us who are more isolative or have been more isolative as a result of the pandemic, finding ways to reconnect with people safely. So if you've been vaccinated and boosted, you could, connect with people more safely, or wear a mask, or, socialize with people outdoors if that makes you feel more comfortable. Join a dance class, or even do online classes, play a sport, get outside, use social media to stay connected to friends. So my family, who mostly lives in Chicago and California, we couldn't see each other for a long time because none of us felt comfortable flying when the pandemic began, and we didn't realize how long it was going to last. So we started a every Sunday Zoom call where we get together and socialize. And to this day, we actually do it almost every Sunday. It's a great way for us to stay connected and stay social and hear about each other and support one another. And then I think children and pets can really be a great way to manage and to stay connected, and they get those endorphins flowing. And then relax and reduce stress. Well, sure, easy for me to say. You can't, of course, eliminate all your stress, but using stress reducing techniques. Something that I teach people in counseling is learning how to say no, because some of us have a really hard time with that, and then we feel overwhelmed, and then we feel like really stressed because we took on too much. And then just really setting people's clear boundaries or expectations. If someone asks me for a report and they haven't given me very much notice, I'm often apt to say I'm going to do my best, but just so you know, I have 3 other reports due on the same day, so I'm just going to do my best. And I had one physician write me back and say, oh, don't worry about it, I'll give you a few extra days. So I think just being clear in your intention and setting boundaries is helpful. It's probably the most important thing you can learn in your life, in your personal and professional relationships, is setting healthy boundaries, but sometimes feels hard to do. And then of course the obvious, that mindful breathing, sometimes just taking 3 slow, deep breaths and letting them out can be really helpful. Yoga, Tai Chi, going onto YouTube, there's lots of free programs there that will help you just get a taste and figure out what you like. And then just controlling risk factors. So staying healthy is also going to stave off things like diabetes or hypertension. But if you already have those conditions, that's okay. Just work with your medical provider about how to stay on top of them, because things like uncontrolled diabetes can be an onset or a trigger or connection to things like dementia. Same with hypertension. If you don't manage your blood pressure, it can lead to things like stroke that can certainly lead to vascular dementia. So be aware of your medical history. We all don't like to think about those things, but they'll serve you well in the end if you can be more proactive. And then strive to be active socially and physically in some way, shape, or form, and just start small and build on it. And so I think I'm going to pause here. These are just some resources I put together, but I don't know if there are any questions in the chat, or if you haven't put in a question, please do, because I'm happy to try to answer it to the best of my abilities.
So we didn't have any questions in the chat. Veronica was kind enough to post how to sign up for research studies. If anybody wanted to do that, that's in the chat box, and it's www.endalznow.org in case people want to see what there might be that's out there.
And thank you for setting that one up, Veronica, because that's one that I wanted to mention specifically. It's actually our Alzheimer's prevention initiative. So you can sign up to be part of what we call the Alzheimer's Prevention Registry, which is actually, I'm part of the registry. It just means that if there are studies that are going to come up that are going to be appropriate for you, they will let you know. And it doesn't obligate you in any way to participate. But it's also a great way to get information about new research, because our folks in API will send quarterly calendars of programs that may be going on that you're interested in, research opportunities, but also a lot of really good tangible articles on what's happening in research if you want to stay ahead of the game and stay abreast of what's happening. And then there's also, of course, the Alzheimer's Association, which is a national non-for-profit that has a great helpline. If you have questions, maybe you're a family caregiver and you're worried about your person, or if you wanted more information from them, they also have great education and support groups. the local area agency on aging. If you're somewhere else, there's an area agency on aging in just about every county. I just put the one specifically for Maricopa County, but you can look up area agency on aging in your county through a web search. And then for those of you who might be caregivers of somebody with dementia, the Arizona Caregiver Coalition actually is a coalition for caregivers of all sorts. So maybe you're taking care of somebody even with cancer or a child. That's a great resource. And then I just put on here our institutes if you're interested in medical intervention or being part of our research. And then I took the activate those 8 things that you can do well to prevent dementia and really help and prevent good brain health is the Global Alzheimer's Platform. And they have a great website. And then I came across one as I was preparing this talk, the Alzheimer's Disease International also has some great resources on how to reduce your risk, particularly during the COVID era. And then we do have lots of programs that are free to you. If you wanted to see one of our providers, that's great. But if you have your own provider or you're not interested in coming to one of our clinics, almost everything we do is free and available to anybody in the community. And since the pandemic ensued, that's one of the great things that has come out of the pandemic is that we have so much virtual education and support that you could really just sign up for our Beacon newsletter on the website that Veronica put in the chat. And you'll hear about any events or programs that are happening, whether it's educational or support group or a topics discussion group. Our events and outreach team launched a podcast just over a year ago. Gosh, we've had, I think, about 30,000 plays, something crazy like that. And so it's just a great opportunity to get on-demand education through Dementia Untangled. Again, you don't have to be affiliated with us at all. You could just download it, as they say, wherever you get your podcasts, whether it's on Google Play or Spotify. What's the other one? Spotify, Google Play. See, now my memory is failing me. Or just go to our website. I listen to mine actually on Apple, so that's the third one. So lots of great opportunities for education, and you could actually use your camera on your phone to actually access the podcast just by putting it up to the screen on that QR code. So anything that you were hoping I would cover, Emily, that we didn't have a chance to, or any other questions that have popped up?
As always, I think you've done a great job, and I think it's so nice to hear things that people can do within their own lives that are not overly burdensome to try and stay healthy. As you said, you know, good heart health is good brain health. And it's a reminder to continue to strive for good health and feel upbeat about that. You know, there are things you can do to make things better. There are things that we can do as care helpers to also help with our own health. Because if our mental health suffers, then the person we're trying to take care of is not going to be doing well either. So you must take care of yourself.
And it's hard to balance those two things, particularly if you're a care partner. So I think you're right. It is really critical though. And it's empowering to just even take very small steps, you know, just set an intention that you're going to walk, you know, 10 minutes twice a week. If you've never exercised before, don't set yourself up for failure. Don't think you're going to exercise 7 days. That's just setting yourself up for too much. But, you know, 2 days of a 5-minute walk, or even someone I was with the other day said they were really trying to get in their steps. We were in a meeting actually, and it was a long meeting. And so this person was just literally walking around the conference table because she was tired of sitting, and she has a really hard time getting her steps in. So I thought that was really creative.
Yeah, that's excellent. Well, we're also just about at the end of our hour, so your timing is perfect. I'm so grateful to have you here today, and absolutely so thrilled that we are a community that has the Banner Alzheimer's Institute, that we have great programs, great services for folks who may have some form of dementia. So thank you very much. Thank you to those of you who attended today and listened. And of course, the recording will be available. So I wish everybody good health, and we will see you next time. So thank you again so very much, and take care.
Thank you.